Michael, his scoliosis story is a little different. Every time they did the typical tests for the doctors where they come in and they look and they do the screenings, he never showed any signs or symptoms of scoliosis. He was having difficulty with his knees. He was always holding his back. He would not be able to walk for very long. He had to constantly sit. He couldn't even enjoy Disney. It's like other kids wanted to go to Disney. He was like, no, I'm good. So we went to the ortho and they looked and they said, okay, you should do PT for your knees. That wasn't helping. We went back to the ortho and they said, oh, you have like an 8 degree. It's not really scoliosis. We'll just watch that. He'll be fine. Fast forward like 9 months, he was getting worse. His posture, he couldn't lift his head. He couldn't straighten out his knees. His one leg was actually turned out all the way, so he couldn't even keep his shoes on. And he was just dragging his foot while he's walking, and we were told to come back in a year. And I said, well, we can't wait a whole year. So we went about 9 to 10 months, and he was almost at 30 degrees. He was like 29, and they said, wow, that was rapid. Basically, I was like gobstopped. I was like, what? He's almost 30 degrees? You said we were gonna be fine. And he wasn't. So we're gonna have to do something. They never expected that. So they said the Providence brace, and I thought, well, I kind of know about the Providence brace, and I haven't heard much success. So I said, well, what if this doesn't work? And he says, well, we'll just do surgery. And I thought, oh, that's not an option for us.
In mild scoliosis, especially in an adolescent case that's still growing, the risk is how much will progress. And what causes progression is growth. And since you can't stop a child from growing, it's going to happen. The risk of progression is always there. And there's never been a case in my 25 years that the curve has progressed and the person said they're glad they did nothing. Every single one of them wish that they would have told them to do something sooner. But since there's no good treatment option in the orthopedic model for a mild scoliosis to try to stabilize or to try to reduce it, they don't offer anything, because the only treatment model they have to reduce the scoliosis is an invasive rod-altering surgery, life-altering rod surgery. So what we can see is a very rapid progression, like we saw in Michael's case, in this, from 2018 to 2019, where this curve actually triples in size, and now you're looking at a curve that's approaching surgical levels, as opposed to where if you would have taken care of it when it was 8 or 10 degrees, you would never deal with that. But now that we're sitting at this curve, at least we're at a stage that we can at least manage it if we treat it properly.
It's actually one of my dearest friends that actually found cleared scoliosis. And she called me in the middle of the night and she said, I think I found something. I think you'd like this. And that's how we found Dr. Tony.
Treatment's been pretty exhausting, but it's like, over the course of a couple of years, you can get used to it. I exercise for several hours a day, but it's not that bad anymore. Plus, it's kept me in shape as well.
My son is very diligent with his exercises. He does them every day. He does his entire program without fail. He was wearing the brace for 23 hours and he quickly improved. Now he is down to 12 hours and actually we were just told he can go down to 8 hours.
One of the major components of our program, a multimodal program, is going to be exercise, and it's going to be something called scoliosis-specific exercises. These exercises are designed specifically for that person's scoliosis, not for a person with scoliosis. It's two different things. It is their scoliosis, so we give them exercises for them to be compliant with and for them to do at home. This is extremely important to set them up for when we want to start reducing their bracing and start weaning them from the in-office therapy and exercises that we're doing in office. So the stronger they can develop their body, the stronger they can develop their rehab program, their exercise program that corrects their scoliosis, the better it's going to stabilize and hold when we wean patients from their care.
Now, Michael, after all this treatment, it has been worth it. His worst part is about 8 now. So he's under 10, so honestly even though he has scoliosis, that's not considered scoliosis.
I mean, I've been very dedicated with what I do. If I'm not, then I imagine I probably wouldn't be here. But it's not just me anyways, like the doctors here, everybody who works at this institute are amazing people, and they've definitely made it so that I could get to the position that I am in now. Everybody who's here supporting Dr. Tony provides basically everything, not just for my spine, but he's helping my neck, my knees, my gait. It's just about everything.
So Michael had some other complications going on, and these other complications, other signs they were having were also signs of something called neuromuscular scoliosis. And neuromuscular scoliosis is another type of category of scoliosis that's not just idiopathic, meaning unknown cause. Neuromuscular means that there's something going on with the nerve system or the muscular system or connective tissue system that could be associated to the scoliosis not worsening, but can also worsen as their scoliosis worsens. So the reason why Michael saw results or improvements in some other things that he was dealing with, because we were actually stopping the cause and reducing the cause and improving his neuromuscular system so his body was able to recover from some of the other issues he was dealing with, even though we were just addressing his scoliosis. So it's very impactful, reducing a curve and what it can do for somebody and what the effects it can be resolving, not even if they think it's directly related.
It's just been like night and day. That we're blessed. We're very grateful. It has changed his life.